I'm Dr. Daiana Flesher. I trained in internal medicine, but my specialty for over the last 25 years is in women's health. And in my clinic, I have a lot of women who come in to evaluate their risk of breast cancer. So the discussion about genetics and breast cancer is a really common factor in my day-to-day work. So there are many myths that are circulating. One of the myths is that if I'm not Jewish, I'm not at risk, which is not true. There are many, many mutations that have been found in many different populations across the world. And while there are some populations where the mutation has been found more commonly, any kind of mutation can be found in any woman. So really the drive today is to explain to women what their risk is, and for women to be able to get tested and to see whether they're at increased risk than other women. And the test is it's a blood test. It's a very simple test. It's not painful. It's not involved. Not complicated. And the discussion that usually has to happen, and that women can also read about and learn about, is what does it mean to be a carrier of a mutation or to not have the mutation? So like one of the myths that women will come in with, a woman will say to me, well, I don't have to worry about it because I don't have any breast cancer in the family, so I don't have to be tested. And first of all, that's not true, because sometimes if the family is not a very big family, if the mutation comes from the father and not from the mother, which is another myth, well, my mother is fine, so I don't have to worry about breast cancer, but the mutation can also be passed down by the father. So if the father didn't have any sisters, then maybe we don't really know about the breast cancer risk. The other myth is that it only has to deal with breast cancer. And that's really important. Today, I think that we understand that probably eventually we're going to understand that every cancer has some genetic component. And so we know that there are several cancers that are associated with the breast cancer mutation. So there's cancer of the pancreas, there's cancer of the ovary, there's prostate cancer in men, there's also breast cancer in men, and there's melanoma. So those are the ones that we know about, and all the time we're learning more and more as we understand these mutations. And one of the things that I think it's important for people to understand, and this is also men and women should be tested, not just women, obviously, because what I just said. Well, I remember two cases that I had that stick out in my mind, and one was a family where my patient had a brother and a sister who carried the mutation, and they had done it because their father had been sick. And they were both her siblings were like in an early detection, basically a data bank, but they were very interested in learning about it and being very active about it. And she was petrified. She did not want to have the blood test done at all. She was too scared of finding out. But in the conversation with her that I had, we had a couple of these conversations, it turned out that she was petrified about getting cancer, and this was overwhelming to her. And it wasn't that she was going to be less anxious if she didn't do the blood test. And so we had to talk about it, and she finally said, you know what, I'm ready to do the blood test. I understand that anyway, this is worrying me, and I'm not going to be more worried. And she was ready to accept whatever the result. And paradoxically, she turned out not to be a carrier. So that was one thing. And that actually spared her from doing all these tests that really for her were not necessary. The second case that I had was a woman who actually didn't have an extended family, but her father had pancreatic cancer. And she was reading up about it. She was very informed about it, and she learned that there was that BRCA2 can be associated with pancreatic cancer. So she came to several of her doctors and said, shouldn't I have the test for the mutation? And they said, well, only 10% of pancreatic cancer is genetic, and even if it was genetic, you only had a 50% chance of inheriting it. So then that means your chance of getting it was 5%. And she said, okay, but if it's 5%, for me, that's 100%. So, and she had the test, and she was a carrier. And that could have saved her life, because it also increases her risk of breast cancer. So there are early detection steps that people can take, and the whole point is catching cancer early. I think that makes all the difference in terms of survival, and so that's the whole push today is to encourage people to do the testing. And I'm not going to say that it's not a complex decision. I meet all kinds of reactions from patients who say, I don't want to know anything. And I have other patients who say, no, I feel empowered with knowledge. I feel that I do want to know, so I can take the steps to protect myself. So some of the communities that I work in, and we do a lot of outreach in different organizations that I work in, where we explain about different cancers. First of all, you do have to work with the community's tradition in terms of superstition. So there are some communities that feel that you shouldn't mention the word cancer because that's bringing the evil eye, that's going to cause them to have cancer. They don't want to have the number of the Cancer Society on their refrigerator or to talk about it at all. And so we work with that. We work with what does it mean in terms of bringing the evil eye, or thinking that some of the things that you can do can make you have cancer, and that really is education and explaining about genetics. And some of the most afraid patients are the ones who actually do have it in their family. And once you start talking with them about what it means and what they can do to take steps to protect themselves, there's a lot of the anxiety comes down. Really, they feel so much more armed with knowledge and what they can do, and especially because sometimes they feel helpless, like they thought there wasn't anything they could do about it. There wasn't any early detection, that it didn't matter, that it wasn't going to help, and so that's been very helpful to work with these communities. The other thing that's very important is to have communities understand why their particular communities, their particular village, their particular ethnicity might be more at risk. And that brings us back to what we call founder mutations. And for instance, the BRCA mutation is considered a founder mutation, meaning that somewhere, I don't know, 1,000, 2,000, 5,000 years, or who knows how far back, the gene mutated and became abnormal. And then because this particular village or this particular group or ethnicity tended to marry traditionally within the tribe, within the village, so that the mutation just became more and more common as it was passed down, through cousins, and then cousins married cousins. And so that's why certain ethnicities and certain groups need to be more aware of the fact that they could be more at risk than others. But in general today, I think that the trend is really to start to explain to people that pretty much you can't exclude anybody and say, oh, you're not at risk, don't worry about it. One of the discussions that we have, for instance, with women who find that they have the breast cancer mutation, is whether or not they should have their ovaries removed. Because one of the things that is well known is that the mutation not only increases their risk of breast cancer, again, not 100%, but it also increases their risk of ovarian cancer. Less, but again, certainly, and not certainly nowhere close to 100%, but it does increase the risk. And the difference between breast cancer and ovarian cancer is that for breast cancer, we have pretty good early detection. For ovarian cancer, we do not have good early detection, so that the ovarian cancer is often found at stage 4. So, and we know that also removing the ovaries decreases the risk not only of ovarian cancer almost completely, about almost 99%, really very high, but it also decreases the risk of breast cancer in young women. So once they've completed their family, we do have a talk about, what do you want to do now in terms of surgery? And women are often very afraid of the surgery, and they think it's going to change their lives, and they're very worried about it. But they're also very worried about the cancer. And so many women find that being proactive and actually doing the surgery, whether it's oophorectomy, taking the ovaries out, or doing also a prophylactic mastectomy, preventive mastectomy, find that their anxiety level really comes down and they feel like they've really taken steps to keep themselves healthy. And we know, for instance, that the preventive mastectomy decreases the risk of getting breast cancer by 90%. So that's huge. And for someone who's seen, especially, a mother or an aunt or a sister die of breast cancer, this is huge for them. They really, they feel like, wow, they're going to be there for their children. They're going to be able to, not have to struggle and share the same fate. So it's really very important, and it all starts with doing the test. So I think it's very important for women and men not to keep their head in the sand and say, I just don't want to know about it, because there is so much that you can know about it. So I think first opening the discussion, reading about it. You can read about it on the internet. There's a lot of knowledge that you can get. Talking to women who've done the test. More and more people have been doing the test. All these genetic companies that offer so many different options. And so people are discovering that and really being very grateful that they went ahead and took the step. So a common question also is, once I know that I have a mutation, what does this mean for me in terms of screening? So these recommendations are really evolving. They're different in different countries. There's an effort really to be very clear about these recommendations. But medicine is always evolving. So currently for breast cancer, the recommendation is, and again it varies in different countries, but basically to have a mammogram every year. And then 6 months after the mammogram to have a breast MRI, and which basically does not involve radiation, and to have periodic, frequent breast exams and also breast ultrasound. So, and everybody does it a little bit different, but that's kind of the general screening. For younger women, we don't like to expose them to radiation because breast tissue is more sensitive to radiation in younger women, and also the breast tends to be more difficult to really assess with a mammogram. So an MRI and ultrasound are used more frequently in young women.